If you have a deep cavity, an infection at the root tip, or severe tooth sensitivity, your tooth probably needs a root canal treatment. A root canal treatment is basically a procedure where the nerve inside the tooth is removed and the empty space is cleaned and filled with special materials. When we look at a decayed or infected tooth, the first step is to remove all the decay and reach the nerve chamber. In the second step, all the nerves are carefully removed using fine root canal files. Then the canals are rinsed with special disinfecting solutions. This way, the inside of the tooth and the root tips are thoroughly cleaned and free from infection. After rinsing and drying, the canals are filled with biocompatible root canal materials. Finally, the top of the tooth is restored with a filling, completing the root canal treatment. In some cases, the filling may need to be quite large, which increases the risk of the tooth breaking. In such situations, placing a dental crown is often the best solution. We'll talk more about dental crowns in our another video. But for now, don't forget to visit your dentist for a professional evaluation.